Hi, welcome to my channel. So today's video, I wanted to do a real quick video as to why I switched from my IVIM Health provider to Fridays telehealth or Join Fridays. The decision was pretty much just because I wanted a more affordable approach to my GLP-1 essentially. With IVIM Health, there was no really any negative qualms with them as far as like the conversation, the enrollment, the follow-ups. Towards the end, there was just like a small mishap with the follow-up piece, and I'll get more into depth with that. But I just wanted to just come on here and really just walk through my journey and as to why I really switched over from IVM Health to Fridays. So I started my journey with the GLP-1 back in July 25th. And when I actually started the prescription, before I did that, I actually was trying to get the prescription through my medical provider, my primary care physician. And she did approve me for Zepbound 2.5. So when I tried to actually go through the pharmacy and go directly through my provider, obviously my insurance does not cover it. Unfortunately, I'm not considered, well, not unfortunately, but I'm not considered morbid obese in order to be eligible for it, since technically it would be categorized under weight loss. Technically, my pre-diabetic condition does not qualify as a medical type 2 diabetes. And so thankfully, since I'm a pre-diabetic, I've been a pre-diabetic for 2 years. I've only been trying to control my sugar intake, my weight loss. I've been trying to do everything by the book, if you will. I'm not perfect by all means. I have had times where, unfortunately, I do have that sugar craving. And unfortunately, it's a downfall for me. So, what I decided to do after I did research was look into different medical providers. The number one provider by Forbes, I think it was like, uh, I think RO I think it's RO. I think that was number two. Number one was I think med something. Um, just when I went to the site, I was not really interested, and then the RO provider I think was a bit expensive too. So IVIM Health was on the top, I think 8 medical providers. So was Friday, but IVIM Health was above it, and so I decided to join them. I signed up for the consultation. I spoke to a provider. The conversation was okay. It wasn't the greatest. It just very basic information. Did not ask for blood work. I sent them my old blood work from 23 and 24. And the reason why I wanted to actually start this journey. And it did take a while for me to actually receive the medication. It took about close to 2.5, 3 weeks, I want to say. I think it was coming from overseas because it was Mounjaro. And so I did that. I paid the 79.99 membership fee plus the cost of medicine, which was around roughly 490 and change, close to 500. So I did that for an entire month. As soon as I wanted to refill my prescription, this is where things changed. I was trying to refill my prescription online. I was trying to, actually, I should say, I was attempting to do it. And unfortunately, it was asking me to add additional supplements to my cart before even able to refill my prescription. I was not interested in that. I sent a chat message to the team. I called them. Unfortunately, calling them, I was unable to get a hold of anyone. And it was during business hours. And also, so I submitted the chat asking, hey, I'm not interested in supplements. I just want to renew my prescription. And can we also talk about the options of potential Zepbounds? Because that was the initially request of my medical provider back home. And it was like crickets. Unfortunately, there was no response until probably like 48 hours afterwards. And so by that time, I was already doing research on other medical providers, which one I would be interested in, which one had best customer service, things of that nature. And from a cost perspective too, I wanted to see if there was anything, comparable and still effective, but a little bit more affordable without that membership fee. My biggest qualm was the membership fee. Unfortunately, what helped me make that decision to switching over was just the last minute. upsell of supplements when I was just trying to get my prescription. I take my own supplements. I was not interested in doing that. And there was no way of bypassing it. So that was one of the reasons I did that. So fast forward to like August 11th, I canceled my IVIM Health subscription. I signed up with Fridays Health on August 12th. I had the appointment with the Fridays telehealth provider. Um, Great, very informative, very detailed. They asked so many questions. I was able to ask my questions, the different options, what I was interested, what I was looking for. It was very, very, conversational, and I really enjoyed that. On August 14, I went ahead and I did my blood work through Quest, which is our local lab work here. I did make an appointment for that. It was a speedy process. They sent and emailed me the lab work information just so I can scan it and just give it to them when I got there. So everything was done electronically. And so I didn't even have to give them any form. They already had it when I got there because I didn't make the appointment. And so fast forward to that, August 22nd. So this all happened within a span of the same week. After I did my lab work that same day, so I did the consult August 12th. I received my prescription in the mail August 14th. Again, this is a compound tirzepatide. I started off, they wanted to match the actual prescription level that I was with Mounjaro, just so it doesn't have any side effects or anything like that. So they kept me at the same um dosage, if you will. So when you convert this into the syringes, because I had a pen, then I went to syringes, trizepatide compound through Fridays telehealth, it was 12.5 units for me. And again, please take all of this data information just with a grain of salt. This is what was working for me. This is what was prescribed to me for my journey, for my you know body type, health issues that I have. And so again, just because I have the 12.5 doesn't mean that you should go get that. Just whatever your doctor prescribed, whatever your doctor thinks is best for you, stick by that. So I did that. So yeah, so August 22nd, I did my first injection of 12.5 units, which I always do injections on Fridays. So I did that. And then I did the entire month two of my GLP-1 journey with the compound trizepatide from Friday's Telehealth. My trizepatide, it is 70% GLP-1 component, but they do, for this one, they added B12 and NAD is my understanding. And so for that entire month, I did not take my additional NAD or B12 supplements just because I was already getting it through my prescription. So that was pretty cool from that perspective. I was able to save some money from that standpoint. And so I'm glad to say that, as the weeks went by, because I did do an entire month too, like an entire month on the compound. I went ahead to, hey, I got a reminder from Friday saying you're approaching your time to file your prescription. Make sure you answer these questions. So I did. I did a quick questionnaire. I did want to ask about like the different options. But we went ahead and did the trizepatide compound because I did tell them like, hey, I did have some like hunger on day 5 and then some cravings, but I think the cravings were like during my period time frame. And being nauseous and then having some constipation, unfortunately. So they actually prescribed a higher dosage, which I'll get into that in my next video. And it's a bit different. Now it's no longer B12 and NAD as the compound. It's trizepatide, and I think it's I can't remember the word. I'll type it in just so you can know what that means. And so I'll start that journey on Friday when I do my injection for month 3. Okay, so I wanted to show you the difference between the actual Mounjaro pen and then what you receive through Friday's Health for the compound trizepatide shots, and the kit what it comes with. So the Nordic pack to keep your prescription cold. My Mounjaro from IVIM Health came in a very similar package, FedEx, but pretty much it was actual pen, and then you put the needle here, and then you just turn here the dial in order to actually adjust your dosage. For me, it was 2.5, so I would just keep turning it until it turned into 1. So I can no longer use this anymore. It says that to discard anything after the excess amount is what it looks like. It was the 2.5 milligram, and it's the name brand. Moving on to what you get with a compound, or at least through Friday's telehealth. I received this package. This is from my actual first um, month with them. The pharmacy that they actually filled it by, or the pharmacy that they're affiliated with, at least for my compound, is the Link Pharmacy. They're located in Texas. My prescription was inject 2.5 units and keep this refrigerated. It comes with NAD, and then of course the B12, as I mentioned. It comes in the secure fill container, and the vial is very tiny, as you can see. The pen, which has the prescription, was full, completely full up to there. And then the vial here, which this substance is red, just so you know, because of the NAD and the B12. What else? So because this one's a pen, I think it's easier to apply. It's more efficient. You only have to put in the needle, disinfect the needle. This one's a bit more convoluted when it comes to that. You have to be very careful. You have to be someone that's okay with injecting themselves. It comes with um, 31 gauge millimeter of syringes. Oh, sorry, it comes with 10 syringes of 8 millimeter. So this is usually for insulin syringes. That's how you would know how comes packet like this. It comes with alcohol swabs. And then it came with this, which this is what I keep in the refrigerator. Instructions on how to inject yourself. I guess the differences between the units versus how the Mounjaro and Zepbound or even Ozempic would consist of, and then how to inject yourself because it is a bit different. And then just information about the drug itself, like the prescription itself, tirzepatide, because I am taking a tirzepatide compound. But yeah, I wanted just to kind of share what that looks like. I did keep this in the refrigerator just because it's easy for me every week for me just to and you know administer my prescription, but everything else I just keep it in my medicine cabinet together. But although it says discarded, I had it just for reference purpose. I don't really intend to use it because you're supposed to discard it after the 4 weeks. And again, keep this refrigerated. And then, like I mentioned, my prescription's changing. It went up for month 3. Technically month 2 with Friday's telehealth because I did my first month with Mounjaro. But I wanted to kind of show the difference between both prescription. But overall, great journey so far. But so I'll be doing a quick update video of my journey for month 2, but I wanted to share my journey as to why I switched over from IVIM Health to Friday Telehealth. Again, no negative qualms with IVIM Health. I would recommend them. The only thing for me personally, the membership was not feasible, plus the cost of medicine. Although you were getting a brand name prescription, it was under $500 compared to if you go by yourself and go directly through Elite what is it, Eli Lilly. Like I think it's still close to 1,000, or maybe it's cheaper now. So I may do some research on that if I would get Zepbound directly through them, how much that would cost me. But again, my journey for being on a GLP-1 is because I was diagnosed as a pre-diabetic. I've done everything under the sun to really work out, to lose weight on my own. But unfortunately, it was really a struggle for me. The food noise was really there for me. And unfortunately, I had to find a solution. I do work out, 5 times a week. I walk every day, but I needed to have like that additional push and support and help for me to reach my journey goal, like my weight goals, right? So I'm still not there. I still have a long way to go, but I've lost in total in 2 months 25.2 pounds, which I'm super excited, and definitely I'll do a separate video of what that looks like just on month 2's on my journey for month 2. So again, I just wanted to come on here and share my experience. I highly recommend both IVIM Health and Fridays Telehealth. For me personally, Friday Health works a lot better for me. My prescription comes from Texas, and it comes to my door. It's really quick. After I did my renewal for my prescription, it shipped in 2 days. So again, very quick and fast service. I really appreciate everything from Friday's telehealth, and I enjoy my journey so far. And so I'll keep you posted on how that goes and continues. But if you like watching videos like this, just add a comment below. What type of videos you would like to see more around my GLP-1 journey. This is all new to me, and this is something that I'm being vulnerable about. And I just wanted to kind of just show and share my journey here and just kind of give some great tips and experience in my personal experience of what that looks like and what side effects come along with that journey. So thank you so much for sticking around and watching my video. Until next time, bye.